Hello, everyone. Welcome to another session of Health and You, the Community Wellness Series. My name is Dr. Amit Abraham. I'm the Assistant Director for the Institute of Population Health. So for those of you who are aware, we host this session, the Health and You Community Wellness Series monthly. And the overall aim of the series is to try and raise community awareness about health and disease. And the idea behind it being we want to try to enhance self-care, reduce suffering, improve quality of life, and increase healthy longevity. Please note that this is not a CME CPD activity. It's the intended purpose, the intended audience is the general public. So there will be no CME or CPD points available for this session. So some housekeeping rules before we begin. Your cameras and microphones have been switched off. If you have any questions you want to pose to our speaker, you can please use the Q&A feature. Alternatively, you can also use the chat, and we will relay these questions to the speaker at the end of the session. So I will be moderating the session. And again, this is not a CME or CPD activity, so there will be no certificates of attendance. So let me introduce our speaker for today. I'm absolutely delighted to introduce you to Dr. Moune Jabre, who will be talking about thriving after birth, postpartum health and wellness. So a little bit about Dr. Moune. Dr. Moune joined Weill Cornell Medicine-Qatar in 2015 as an assistant professor of clinical obstetrics and gynecology. At WCM-Q, Dr. Jabre holds multiple leadership roles, including Assistant Dean for Academic Affairs, Director of the Learning Enrichment Office, and Associate Director of the Obstetrics and Gynecology Clerkship. Her academic interests include simulation, remediation, development of medical student cognitive and clinical reasoning skills, mentoring and coaching, and women's health. Clinically, Dr. Jabre provides a full range of obstetric and gynecological services at WCM-Q's affiliated hospitals. Dr. Jabre speaks English, Arabic, and French, and possesses an exceptional ability to practice culturally humble medicine while thriving in a multitude of environments. Her clinical and research interests include evaluation and management of ectopic pregnancy, gynecologic and first trimester obstetric ultrasound, and emergency obstetric and gynecologic medicine. Dr. Jabre, we are so excited to have you here. The floor is yours.
Thank you very much. I appreciate that very kind introduction. I will just share my screen now. I'm delighted to be here today to talk about postnatal health and wellness so that we can help women thrive after birth. So I have no financial disclosures. And today we're going to talk about during the postpartum or postnatal period, depending on what part of the world you're from. It can be either postpartum or postnatal. They mean the same thing. We're going to talk about physical recovery, emotional and mental well-being, some practical tips, and then knowing when to ask for help, which is probably the most important thing today. So what is the postpartum period? It begins immediately after birth and lasts for up to 6 weeks or 42 days after the delivery or the birth. Medically, we divide it into the immediate, which is the first day, the early period, which is the first week, and the late period, which is everything else because of the things that happen during those periods. I'm not going to necessarily make that distinction too much today, but if I do refer to it, that's really all I mean. So why does it matter? Well, during the postpartum period, women will have to adjust to a new self-identity. They're going to develop confidence and skills as a mother. They need to adjust to relationship changes with their partner and with their family. They want to manage the normal physical and emotional challenges of the postpartum period, and they need to have strong support and accurate information to be able to do all of this successfully. So really, it's a critical time for both moms and babies. We'll start out first with the physical recovery, and these are some of the symptoms that we're going to talk about today. And the first one that I want to mention is the uterus. I'm going to talk about every part of the body a little bit separately just to help kind of divide how we think about things. And so for the first part, we're going to talk about the uterus. The most important first step is that the uterus has to clean itself and it has to start to heal and it has to shrink back to normal size. And this is done immediately. From the minute the placenta is delivered, the uterus starts to shrink back to normal size. And it's going to do this by cramping. And if those of you in the audience have had babies before, you might have noticed that right after the baby was born, if you delivered vaginally, the nurse starts to kind of massage the belly a little bit because that helps the uterus contract as well. So this shrinking and that cramping and contracting that happens is a critical step, even though it's painful, because it's one of the most important ways that your body can naturally help defend against bleeding after a delivery. And it happens after a C-section as well, because you will feel cramping and so on. And so that uterus starts to shrink back to normal size. Now, before delivery, the uterus is about the size of before pregnancy, the uterus is about the size of a fist. And then obviously it has to get big enough to hold the baby, all the water, and the placenta. So it gets quite large. And then immediately after birth, it has to start to shrink back down. And it's about at the level of the belly button while you're still in the delivery room. And then over the next few days, we'll slowly start to shrink back down to almost, but maybe not quite pre-pregnancy levels. And the way that the uterus does this cleaning process and this shrinking process is that it has to get rid of all of the remaining mucus and blood and tissue that's in the uterus. So that's going to pass as a vaginal discharge and vaginal bleeding, and that lasts for about 4 to 6 weeks. It should start out like a normal period. It should smell like normal period blood or old blood, but it should not smell like anything strange or like an infection. And in fact, some important warning signs to keep an eye out for would be fever, worsening pain, because the pain should start to get better immediately after delivery. It should steadily continue to get better. There shouldn't be a time when it suddenly gets worse. So if you start having worsening abdominal pain, or the smell of the vaginal discharge or blood just doesn't seem right, or if you're having excessive bleeding where you're soaking through one of the postpartum pads per hour, all of those are urgent signs for going to see your doctor or even going to an emergency room, because they could indicate either bleeding that's going to continue or potentially an infection. So here I wanted to show you a little bit of what it might look like. So on the pads in the first week, it's going to look pretty much like a normal period with bright red blood, maybe a little bit darker blood, sometimes little small clots. All of that is completely normal. And that vaginal bleeding and discharge is called lochia, just in case your doctor or somebody refers to it. It is called lochia. That's what we refer to it. And then over the next week or so, it's going to turn into a lighter amount, more pinkish, more brownish discharge. And then slowly over the remaining 3 to 6-ish weeks, it'll be more like a yellow or whitish discharge, but still more than the typical discharge that a woman normally experiences outside of pregnancy. And an important thing that sometimes takes some women by surprise is that many times you've been sitting for a long time and then you suddenly stand up and that fluid has been collecting in the vagina. So it may be that when you stand up, actually a little bit more kind of comes out, and that's okay. That doesn't necessarily mean that you're suddenly gushing blood. It's just that it's kind of pooled in place and then suddenly comes out when you change position. And you also may feel that as well after breastfeeding or when you start breastfeeding, because breastfeeding triggers hormones that will cause the uterus to cramp. Again, that's the body's defense mechanism to protect against bleeding after a birth. And so you will feel some cramping and maybe a little gush of extra lochia when you start breastfeeding as a result of that cramping. All right, so we're going to talk a little bit about some of the specific things about management of after a vaginal birth, and then we'll talk also about after a C-section. So with a vaginal birth, the areas that are going to be swollen are the vulva, which is everything that's on the outside, the vagina, which is the actual canal, and then this area called the perineum, which is the area that's between the vagina and vulva and the perianal area here. So it is completely normal for this area to be swollen, very sensitive, and even after a completely normal birth, it's going to be swollen and sore and tender for several days and maybe up to a week or so. If a patient or if a woman has a tear as well, or if she has to have an episiotomy, which is when there's a cut that's made either in this area or in this area, depending on the extent of the tear or the extent of the episiotomy, it'll take a little bit longer to heal as well. So it can take, as simply as a week, but it can in some cases take up to 3 or 4 weeks, depending on the extent of the tear. And because of this, whenever there is a more serious tear or an episiotomy, we usually like to see the woman come back into the hospital for a routine check just to make sure everything is okay around the 2-week mark. But if she didn't have a big tear or didn't have an episiotomy, it's totally fine to wait and follow up at around the 5 or 6 week mark. That's totally appropriate, assuming that everything is going okay. If at any point, this is a recurring theme, you start to have swelling, worsening pain, redness, or the discharge start to smell funny or anything like that, then you need to go see your doctor because those could be signs of an infection. How do you care for the vaginal area or the perineal area? Well, these cold packs become your best friend. You'll get a stock of them usually when you leave the hospital, but never nearly enough. So it's better if you can find them at a pharmacy and just buy a supply for yourself. And they're really nice because you just kind of twist them and then that activates them and then they turn into an ice pack, but it's not super duper cold where it's dangerous to have it against direct skin like many ice packs are. This is actually made specifically to be against direct skin, and it actually is made like a sanitary napkin, so it's a little bit absorbent. It's not super absorbent, but it is somewhat absorbent, and they last for about 20 minutes or so. And I would strongly recommend that in the first several days, a woman should use these at least 3 or 4 times a day if she's had a significant tear or a cut, because they do dramatically improve the amount of swelling and they do help with the pain as well. Now, I said they're not super absorbent, so when you're not using them, you will have to use just a normal postpartum or maternity pad, which is like a normal sanitary napkin, except bigger. We do not recommend that you use tampons. It's not safe because that tissue is still super, super delicate, and it actually can increase the risk of infection. So although it's fine to use tampons when you're not pregnant, in the postpartum period, we don't recommend tampon use at all. And in order to help minimize the risk of infection and to help you stay comfortable, it's very helpful if you try to keep that area clean and dry. So how do you keep the perineum clean and dry? In Qatar, we're very lucky because most bathrooms have the sprayers, which is great. You can totally use that to gently cleanse the area. However, please, 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 just test the sprayer first before you put it on your body, because sometimes the pressure is really high. And again, those tissues are very sensitive. Sometimes there's delicate little stitches that the doctor has put in there. So we really want to make sure that it's a low, gentle pressure before you start using it. And if you don't have a sprayer, that's completely fine. They do sell these kinds of bottles in many pharmacies. They're called peri bottles, and they have, or like little, sometimes they're called portable bidets also. You just fill them up with warm water from the sink, and then you can use it to spray to help cleanse the area. And then once you've cleansed, don't rub up and down with the toilet paper, because that's going to hurt a lot. So just make sure you very lightly pat to keep it nice and dry. You can use pain relievers as needed, and make sure that you're kind of shifting position. You're not sort of sitting a lot in one position, because that can also make it uncomfortable. Some women prefer to do pelvic floor or Kegel exercises after birth. That's totally fine. They can help with strengthening the pelvic floor muscles. And in fact, in somebody who's had a severe tear or a big episiotomy, there's actually physical therapy specifically intended for strengthening pelvic floor muscles. And that can be quite helpful, and also helpful for minimizing developing like chronic pain and things like that. And those services services are available here in Qatar. I know for a fact that they're available at Sidra, and I believe they're available at HMC and in several private institutions as well. So C-sections. Here you're also going to have pain, but now it's going to be in the abdominal incision. So the first few days after a C-section are quite painful. The incision really, really hurts, and that's okay. It's totally normal. Luckily, during those first few days, you're in the hospital because you stay in the hospital for usually 3 days after delivery compared to only 1 additional day after delivery for a vaginal delivery. So while you're in the hospital, you will often be given much stronger medications to help manage that pain. And then by the time that you're discharged, the incisional pain has improved so much that it can actually be managed quite effectively with things like Panadol and ibuprofen. Now, Panadol and ibuprofen are both, assuming you don't have an allergy to them, are both okay to take in the postpartum period because they are both considered okay to take in breastfeeding. I would not recommend that you use any other kind of medication unless it's been prescribed by your doctor and they knew that you were breastfeeding if you are breastfeeding, so that we can make sure it's safe for both you and baby, okay? And then over the next few days and into the next couple of weeks, that pain really changes into just a soreness that's occasional or worse with movement, but it really does start to get better very, very quickly. I do recommend for my postpartum ladies that they avoid heavy lifting for about 4 to 6 weeks because it takes 6 weeks for that incision to really sort of heal to the point where it can start to be strong. And so we don't want to put extra strain on it. And if you think about, you bend down, you kind of put a lot of strain on your core muscles, and that puts pressure on the inside organs, and that can put pressure on the stitches from a C-section incision. So it can put unnecessary strain on a C-section incision and affect the healing process. So we do recommend not to do a lot of heavy lifting for the first 4 to 6 weeks. I understand that a lot of women have babies and it's not their first baby and they have adorable toddlers who want mom's attention at home, and that's completely okay. Totally fine. I want you to be able to pick up your baby. I want you to be able to pick up your toddler. Just get a little bit of help. So if you've got a bigger toddler, try to avoid being the one who's bending down and really picking up all their weight. Ask a friend or a family member to help you, help lift the baby up until you kind of have them, and then sit and snuggle with them on the couch. Absolutely bond and spend time. Just try to be mindful of that heavy lifting. This is not the time to be carrying big laundry baskets or vacuuming or bringing the groceries in from the store or anything like that. So take it easy. And for the same reason, I usually tell people to avoid driving, just because if you have to brake all of a sudden, that sudden brake can create the same unexpected pressure on the stitches and can cause a little bit of unnecessary strain on the stitches as well. Now, because you've got an incision, typically, once you've had a C-section, we do like to see the patient after 2 weeks postpartum, just so at least we can look at the incision and make sure that it looks okay. But if if everything is going completely fine, again, that can be pushed a little bit later, and it kind of depends on you and your doctor, how concerned they are about your incision because of your own individual case, etc. So that's something to discuss with the doctor, but it is really important that you make sure you keep that appointment whenever it happens to be. So here's some pictures of, this is a normal incision. Now these little tapey things are meant to stay on for about a week, and then eventually as you shower, the adhesive starts to wear off and you can just pull them off after they've been there for a few days. They do help keep the stitches together, and the stitches are usually under the skin so you can't see them. They dissolve on their own and you don't need to have them removed, but this just gives a little extra support in the meantime. They may not look like this. Sometimes they look a little bit different. That's totally fine. But the important thing is to keep this area clean and dry. That's really hard though, because if you see this patient under the belly is now a little bit lax, and so that skin can kind of fold over. And if you're sitting around, if it's in the summer and it's warm, it's very common for a little bit of moisture to build up there. And bacteria love nothing more than to grow in a nice, moist, warm environment. So to help prevent infection, I love having patients take either an old clean t-shirt or a panty liner and then just kind of folding it and tucking it in under that skin so that it can absorb any extra wetness and help keep the area from being moist. And that really helps with the infection. It also feels a little bit more comfortable because then it's not like, sweaty and it causes a little skin irritation. Like I noted before, signs to be on the lookout for: swelling, pain, redness, discharge. Like here's one example of what an infected incision looks like. But they can look like a lot of different things. So really, if you have concerns, go to the ER or talk to your doctor, because we would rather tell you, nope, it's actually fine, it's okay, than have us miss something where it's growing into an infection and we don't realize it because we don't get to see you. All right, so breast engorgement is when the milk comes in. Now, regardless if you've had a C-section or if you've had a vaginal delivery, whether you plan to breastfeed or don't plan to breastfeed, in the first anywhere between 1 to 3 days, many women do not have milk production, and they produce instead this thick, mucousy-like substance called colostrum, which is actually great for the baby, full of antibodies, super healthy. And we strongly encourage that put the baby to breast at least immediately in the delivery room, right after delivery, and over the next few days, just at least to give them that little immunity boost, which will really help them keep healthy and avoid illnesses in the first 6 months of life, because all of the immunity that mom has gets passed, or most of it gets passed to the baby and helps protect them until their own immune system kicks in. So it's really lovely if you can do it. It's not the end of the world if you can't, but it is really lovely if you can. Now, the milk comes in, and then suddenly the breasts are going to swell, get really tender, and feel very swollen, warm to the touch, and red. And it's going to be uniform. It's going to be in both breasts, and it's going to be in the whole breast. So when that happens, it can be quite uncomfortable. And the best thing to do is immediately to start feeding the baby or pumping, because draining the milk as that milk comes in is what's going to help relieve those symptoms. And this can happen over the space of just a couple of hours. Like somebody may not have engorged breasts, and then suddenly they have breast engorgement, and it's suddenly quite painful. So if somebody has been breastfeeding regularly, they sometimes don't feel it as much because the baby is getting put to breast a little bit more frequently anyway. But if the baby has been sleeping, or the baby's in the NICU or something like that, sometimes the engorgement kind of takes people by surprise, and it can be uncomfortable. So what I would recommend is, before breastfeeding or nursing, when the breasts are engorged, put on a warm compress. And they do sell these little things that are like little cold and hot packs. You can put them in warm water, or I think some of them are microwave safe, but you'd have to check, or put them in the fridge if you want them to be cold. And then they just place them over the breast warm before nursing, and do a little bit of breast massage to help stimulate the milk letdown, and then put the baby to breast or pump. And then after nursing, switch to cold. So some people don't have these, they're not always available. You can actually use a diaper, because they're quite absorbent and they wick the moisture away from the surface, and they are very bendy and can conform the shape to the shape of breasts. So you can put like warm water in a diaper or cold water in a diaper and use it as a quick makeshift hot pack or cold pack. Other things that women can do that are actually surprisingly helpful is, if you buy a head of cabbage and stick it in your fridge, then just peel off one leaf, and then, again, it has that sort of cup shape. You can place it directly onto the breast, and it has a very cooling effect that lasts for several minutes and can be really, really provide a lot of comfort. So again, remember, warm before nursing and then cold after nursing. Okay, and breastfeed and pump regularly. Now, also, nipple care is really important, because the nipples, as breastfeeding is being established, baby's learning how to breastfeed, mom is learning how to breastfeed, there can be a lot of trauma to the nipples. And the skin of the nipples can crack, which is really uncomfortable, and can actually introduce infection, whether it's yeast infection or bacterial infection. And so being careful with how to protect the nipples to prevent some of these infections is very helpful, and to prevent the discomfort. One of the things that I recommend hands down to anybody who's going to be breastfeeding is this lanolin cream. I don't particularly care which brand. I like these two. I've had a lot of experience with these two, and I know that they are available in Qatar. The reason that I like the lanolin cream is that this is 100% organic, medical grade lanolin, which comes from sheep. It's part of the oils of the skin of sheep. And so it's completely natural. And because it's medical grade and completely natural, you can apply it to the breast and then you don't have to wipe it off before nursing, which means that you can like nurse unexpectedly. You don't have to wipe anything, which prevents abrasion to the nipples and further trauma. And it's really quite effective because it does create a good barrier to protect the nipples. Sometimes the trauma to the nipples happens anyway. And then you can use things like these, which are called nipple shields. They're like a flexible silicone that can be applied to the nipple during breastfeeding to help reduce the direct trauma onto the nipple. Breastfeeding, most of the milk comes out in the first 15 to 20 minutes. But if you leave a baby to breastfeed, it's going to happily stay on the nipple, especially if they fall asleep. So this is a great time for you to feed the baby for 15 to 20 minutes per breast. But then afterwards, if you want to continue to snuggle them, if you want to hold them, that's fine. Just make sure you release the suction and take the nipple out of the baby's mouth so that it doesn't stay in that wet, moist environment that then can breed bacterial infection. Because a common infection in breastfeeding is mastitis, which, unlike engorgement, which is kind of redness and swelling that is temporary and normal and affects the breast, here you're going to have one area that actually gets infected with bacteria from the skin getting into the breast. And this requires medical attention. It requires antibiotics. We give antibiotics that are safe in breastfeeding because it is absolutely critical that you keep breastfeeding or keep pumping. You do not have to pump and dump the milk. The baby can go ahead and get the milk. It's okay. And because the medications that we choose are safe in breastfeeding, and you absolutely just need to make sure that that breast is drained because that's what helps cure the infection ultimately. All right, now switching gears a little bit, I've said hormonal changes without kind of getting into all of the different details of the hormones because there's just so many. So kind of umbrella term for all of them. You have all sorts of stuff going on. You're going to see mood changes, hot flashes, almost like you're going through menopause, mild headaches. Severe is not good. If you have a severe headache and doesn't get better with medications, that's a reason to see your doctor. But mild headaches are pretty typical. Changes in libido, constipation, and then unfortunately, all of these things are made worse by not eating well, poor sleep, stress, fatigue, all of the things that happen when a person has a newborn baby in the house. And then lastly, I just wanted to put here that in pregnancy and in the 6 weeks postpartum, some of the hormone changes put a woman at increased risk of getting a blood clot. So that risk is there throughout the pregnancy, but it doesn't go away until after 6 weeks after having the baby. So it persists during the postpartum or postnatal period. And so if you start noticing that you're having new shortness of breath, chest pain, leg pain, swelling, or redness, especially in the calf area, that is an emergency. You need to go see your doctor ASAP, okay? For this reason, I also think it's really important to walk around a little bit. Don't just sit in bed all day, because if you sit in bed all day, that blood isn't really moving around in the legs, and so there's a higher chance of causing a blood clot. So light walking, get up to the bathroom, go fix yourself a sandwich, play with the baby. Those are all good things because they do keep that blood moving a little bit as well. Now, in terms of weight loss, you're going to have an immediate weight loss as soon as the baby, the placenta, and all the fluid is out of your body. And that's about a 6-kilo weight loss immediately in the delivery room. But then the remaining half of the pregnancy weight that you will have normally gained in pregnancy usually is lost in the postpartum period. And then the remainder, it's either lost afterwards or weight gain. It really depends on the individual person. Long-term and exclusive breastfeeding has been associated with more weight loss, but short-term or breastfeeding plus formula feeding, it really in that case depends on the person whether it leads to weight loss or weight gain. As far as the changes to the abdomen, these are the normal muscles, the six-pack, if you will, in the abdominal wall. And this is in the pre-pregnant state. They start to get stretched and pulled apart and separated during the pregnancy stage, which is why the belly button pops out in the center. And then after delivery, they do start to go back, but they probably will never go back to the pre-pregnant state. Now, core abdominal muscle exercises do help, but it's normal to have a little bit of looseness or laxity in the abdominal wall and those muscles. Now, in some people, that separation stays a little bit bigger than what is considered typical. And in those cases, physical therapy or seeing your doctor may help to address some of those things. Stretch marks, very, very common. Most women do end up getting them. But during the pregnancy, if you notice here, the stretch marks are quite dark, and it's because of some of those hormonal changes that the stretch marks tend to be like a brownish or dark reddish color. But after the delivery, the stretch marks start to fade over time to a much more silvery or faded beige color as those hormonal changes start to go away from the pregnancy. Similarly, again, related to hormones, there is some hair loss that happens. So normally hair grows in a cycle where there is a growth period, then the hair is in a stable period where it's neither growing nor falling out. It's just kind of hanging out there. And then it's in the falling out stage. Now, normally all the hair in the head is at different parts of this cycle, so that on any given day, you're only losing a small amount of hair because the majority is in the growth phase or in the stable phase. But the changes in the postpartum hormones shift the cycle so that much more of the hair is in the fall out cycle. So you will see that suddenly, somewhere between 1 to 6 months postpartum, depending on each individual woman, you will suddenly feel like you are losing so much hair. And you will be losing so much hair, but it is temporary, because as those hormones start to go back to normal, the hair cycle starts to go back to normal, and then will be kind of evenly distributed and will start to equalize again. So the hair loss is temporary, but some women do notice changes in the texture of the hair, which may be permanent, like it's less curly or more curly, it's more coarse or more fine, etc. So there are some changes that happen that are irreversible. And then I also wanted to make sure to talk about intimacy, because this is a question that I always get asked, is when can I resume sexual intercourse? And there's a lot of factors that impact that. So there's never a straightforward answer because it depends entirely on that woman. Having a decreased libido or sex drive is 100% normal during the postnatal period and is related to the hormone changes, the fatigue, the sleeplessness, changes in body image, and all sorts of stuff. Relationship changes, mental health changes, all of these things can impact the desire for intimacy, as well as the feeling any intimacy. We do typically recommend waiting for at least 4, but ideally 6 weeks, because we want everything on the inside to heal. We want the vulva and the vagina to heal if somebody's had a vaginal delivery. We want their C-section incision to heal, and we want the uterus on the inside to heal. So we do prefer at least a 6-week wait. But I've had so many patients who have come to me for their 6-week postpartum visit and they are pregnant. So fertility does come back around that time as well. But getting back to, the sexual intimacy, intercourse can be uncomfortable the first or even the first few times after having a baby, whether it's by C-section or vaginal delivery, because there can be incisional pain, perineal pain. Again, the hormonal changes, especially during breastfeeding, can lead to changes in the vaginal dryness. And so it may, everything might feel different. So what I tell my patients is trust your body, use lubricants if you need to, and go slow. So talk to your partner, communicate. That's the kind of the best advice. And as I mentioned, fertility can come back pretty quickly. It depends. Every patient is a little bit different, but it can come back as early as 4 to 6 weeks after delivery. And breastfeeding does not actually protect against pregnancy. It can help, but it's not 100%. So a lot of times I think that many women think that, oh, if I'm breastfeeding, I can't get pregnant, but that's not actually the case. And really, it's so much better for your body if you give at least 1 year between one pregnancy and the next, because pregnancy drains a lot of the reserves on the body. And so you really need that year to build back up the reserves, as well as if you've had a C-section, especially, it's super important because that C-section incision starts to get super strong by about 6 weeks, but doesn't fully heal until 1 year afterwards. So if you've had a C-section and then you get pregnant again, I'm not even talking about the time between one delivery and the time of the next delivery, but the time of the next getting pregnant. If that time is less than a year, it puts your new pregnancy at higher risk because of the incision not having had enough time to heal. So we do recommend contraception. There is a wide range of different birth control or contraceptive options that you can discuss with your doctor to figure out what's best for you. And then, as I mentioned, there's so many hormonal changes, but they are part of the reasons why we have emotional and mental health changes that are noticed as well. But really a big part of it is adjusting to the new role is super duper challenging. So there's some things that are okay and normal and some things that are not okay and not normal and definitely require help. Postpartum blues is something that many, many, many women experience in the first 1 to 2 weeks after delivery. And it is a very typical and very normal, mild type of feeling kind of down. So occasional tearfulness, some mild mood swings, irritability, anxiety, fatigue. I mean, this is kind of like me on a Tuesday, but this is very, very common. And the important thing is that this goes away on its own and it is mild. So the important things that you can do to help someone who's going through this is supportive care, try to help them try to get as much sleep as possible, and really just emotional support and being there. It does not require medical intervention per se, because we kind of wait and see. And it does have a tendency to start early in the first 1 to 2 weeks, but then very quickly women will adjust to their new role and they start to feel better because of the physical changes improving and so on. So this tends to go away pretty quickly. Postpartum depression, on the other hand, is a totally different thing. This is not normal, and this can be quite severe. We call it postpartum depression, but it can actually start during the pregnancy, and it can happen anytime from during the pregnancy to all the way up to a year after the birth. And if it's not treated, it can last a really long time and be absolutely horrible. This is like a major depression. Severe mood swings, difficulty bonding with the baby, pulling away from your family and friends, feeling overwhelmingly fatigued and hopeless, even thoughts of harming yourself or your baby, having severe anxiety. Those are very common symptoms of postpartum depression. And this, I tell people, see your doctor right away. But the tricky thing about this is if you are going through this, you're not going to have the clarity of mind to recognize that you need to see your doctor. So this is really where the family and friends have to be on the lookout for somebody who's given birth to kind of keep an eye on them. And if they see things are changing and it's lasting for more than a week or two, then it's not right. And then you really got to get medical care and help them get medical care. Postpartum anxiety is same thing. It's a form of anxiety disorder. It's not normal, and it's normal to have a little tiny bit of anxiety after having a baby. But if you start to develop new fears, you feel like you can never relax and start to have like your heart is racing or having panic attacks, that is not normal. Most of the time, postpartum anxiety coexists and occurs with postpartum depression. Sometimes it can occur by itself without the depression symptoms, but either way, again, if you notice somebody feeling this way, then they need medical attention because it needs treatment. It needs medication and treatment and therapy and so on. So in summary, again, here's the things that we've talked about, and I want you to get urgent medical help if you have excessive bleeding, severe pain, fever, chills, redness, swelling, discharge from the incision or perineal area, shortness of breath, chest pain, leg pain, redness, swelling. These are signs of a blood clot, and go see your doctor. For the mental health piece, persistent sadness or anxiety, any thoughts of harming yourself or baby, please, please, family, friends, get your loved one to a doctor ASAP. So please go see the doctor, okay? Some tips, they seem obvious, but they're actually quite hard to manage and actually do. But sleep whenever you can. Don't stay in bed for days or weeks. Like, get up, get moving around, go outside if you can. It does actually make you feel better and release good brain hormones. Increase activity gradually, so walking, postpartum yoga, eventually swimming when your doctor says it's okay for the sake of the incisions and stuff. Eat healthy, drink lots of water, especially if you're breastfeeding. And although it feels very selfish, it's actually, I like to think of it as you're doing this to take care of yourself so that you can take better care of the baby. So I think of it as actually totally unselfish. Take time for yourself, separate from the baby, so that you can be you, because a whole healthy mom is what is the most important thing for the baby. And I'm always going to say, please think about contraception to space out the pregnancies and help your body recover. So we've talked a lot about mom, but they're like, Dr. Jabre, what about the baby? Well, again, regular checkups with the baby, growth, development, and I cannot highly stress how important it is to have vaccinations. Mom should get vaccinated. Any other kids in the family should have their vaccinations. Really, everyone should be up to date who's going to be close contact with the baby, because the baby is not going to be able to protect him or herself. So babies' vaccinations and close contact vaccinations are critical for a healthy baby. Additionally, in the hospital, you'll be told how to take care of the umbilical cord stump. So keeping that clean and dry is important. Circumcision care, as instructed, is really critical as well. If you have any concerns, same thing, redness, swelling, discharge, funny smell, go see your baby's doctor or go to the emergency room. Babies should sleep on their back because it has been shown to decrease the risk of something called SIDS, which is sudden infant death syndrome. And make sure there's no loose pillows or fluffy pillows or loose blankets, because babies don't know how to turn around and they can kind of get stuck in that position and potentially suffocate. You can put a baby on their belly, that's totally fine, but make sure it's supervised and while they're awake. So when they're sleeping, they should really be on their back. As I mentioned before, breastfeeding is best. It helps improve the health of mom and baby. Even long-term, later in their life, it improves health outcomes for moms and babies. However, sometimes it's just impossible. Like, it just doesn't work because of physical problems with the baby's mouth, the breasts, the baby's in the NICU or something like that. And then it becomes this like torturous experience for the mom and the baby and creates so much anxiety and actually becomes counterproductive. So yes, breastfeeding is best, but if it doesn't work, it's okay. Formula feeding is okay too. So don't let people bully you into having to breastfeed if it's just not working for you, because what I want is happy, healthy, whole moms who can take care of their babies. Lastly, bond and enjoy your baby. Skin to skin contact, not just in the delivery room, at home is great. With dad is great. So all of that is very helpful. Play, be happy. And remember, go see your doctor if the baby has a low temp or a high temp, 35.5 or greater than 37.5. If they're not eating well, if they're not making enough wet diapers, which is less than 5 in 24 hours, if they're not moving a lot, if they're breathing fast, or if their skin starts to turn yellow, like in this picture, which is called jaundice, those are reasons to go see your doctor as soon as possible. And then lastly, I did want to mention that sometimes the unexpected happens. Like, everybody wants to have a nice, happy, healthy birth, nice, happy, healthy postpartum period, but sometimes unexpected things happen. And when that does happen, it is okay to ask for help. Please remember, you're not alone. Babies sometimes have bad outcomes. Moms sometimes have bad outcomes. So get help, get family and friends. This is my son. This is my third child. And I had a completely normal pregnancy, a completely normal delivery, and everything was supposed to be absolutely, totally fine. And then unexpectedly, on day 1 of his life, he ended up having to be admitted to the NICU for 3 weeks in a hospital that was far from where my parents and my other children were. My husband ended up getting sick at this time, and it was like super stressful. But I was very, very lucky because I gave birth in the hospital where I had worked. And so all the time that I wasn't able to be in the NICU with my baby, all of my friends and colleagues who worked at that hospital would go and hang out, and they called themselves like the Council of Moms, the surrogate moms, and they would just come and snuggle with him when I wasn't there, which made me feel a lot less guilty about when I had to leave him to go attend to my other children. Make sure you get community health and resources, medical resources from, here, HMC, PHCC, CIDRA, the private sector, all of them have great resources, but please make sure to lean on your family and friends. And then lastly, this is my little one who is now a little terror and nice and healthy. And at this point, I would love to take any questions that you have. Thank you very much for your time and your attention.
Thank you so much, Dr. Moune, for that very insightful presentation. I think there are lots of very handy tips for new parents. I do want to mention to our audience, if you do have any questions, please put them in the Q&A or chat, and then we can pose them to Dr. Jabre. So the first thing I want to start off with a question of my own is, you mentioned in one of your tips that one of the pieces of advice you give new parents is to make sure you eat healthy. Do you feel that there is any special kind of diet or do you recommend a more nutritious diet for new parents, or just follow the same routine?
There's not a specific diet. A healthy, well-balanced diet in general is really the way to go. So making sure that you're getting enough protein, enough vegetables, especially if you're breastfeeding, that uses up a lot of nutrients. And so you want to make sure that you're getting enough nutrients that help support good, strong breast milk production, but also your body is having to reheal, and that muscle building and healing, that requires a lot of protein. So just make sure that if you are vegetarian or vegan, that you're getting alternative sources of protein as well.
Excellent point. Thank you. There is a question in the chat about hormonal imbalance symptoms. So how long on average does this last? When is it going to be a cause of concern that perhaps should be brought to a healthcare worker's attention?
So, I mean, the term hormonal imbalance can include so many different things. So it's hard to say just like, oh, it's going to last this long, because some hormonal changes do take a really long time, and some of them are extended by whether somebody is breastfeeding or not, whether they end up bonding with their baby or not, if the baby's in the NICU or not. So there are some, whether they develop postpartum depression or not. So it's hard to say sort of all as a single entity that they should resolve by this point. However, the typical changes in the hormonal fluctuations that happen from pregnancy to postpartum, for the most part, will resolve by about 6 weeks or so, with the exception of the estrogen and progesterone, because those are directly affected by whether someone is breastfeeding and whether they're breastfeeding exclusively or not. So, and estrogen and progesterone are what control the menstrual cycle and fertility. And they can also control symptoms like whether somebody has hot flashes, whether they have vaginal dryness, whether they maybe have a little bit of headaches. So those kinds of things can be impacted, but to a different degree in every single person, by whether or not somebody is or isn't breastfeeding, what kind of contraceptive they are or aren't taking, etc. So it's hard to say, but my best advice would be go to your regularly scheduled postpartum visit, because your doctor is going to ask you a lot of questions that will help them assess and evaluate whether there's anything out of the ordinary. And this is an opportunity for you to report anything and ask questions as well, of course.
Thank you. There is a question in the chat about nipple soreness. So they are asking about silverettes, which are shields. Do you feel that is helpful for new mothers?
Yeah, I mean, I put a picture of nipple shields in the presentation, and the ones that I put on the presentation are a thin silicone shield, which can be put in place and is flexible enough that the baby can breastfeed through it. So it helps protect the nipple that way. There are other nipple shields that are like a hard plastic shell that are meant to go on top of the nipple so that when the woman is wearing a bra or clothing, it helps cover the nipple so that it's not getting abraded by clothing or the bra or something like that. So those you can't breastfeed when you're wearing those, but they can offer protection in between breastfeeding sessions.
Okay, thank you. Another question I think is important in the chat is basically the person is asking, one of my family members has just delivered. How can I support them, or how can the family support them as they go through this postpartum phase? What's the best way to provide
Yeah.
support?
That's a wonderful question, and it's a very kind and caring question. I think one of the reasons that women don't ask for help is because just like, after somebody is born or after somebody dies or somebody's having an illness, we naturally sort of go to that person and say, what can I do to help? And that is really difficult because that person is under so much stress and changes. They can't sit there and kind of do the mental work of trying to figure out what they need help, or feel like maybe they don't feel like they can ask for those things. So I think if you want to try to help, do it in a little bit spontaneously. Like, just show up. Obviously, like, call, make sure it's a good time, etc. But show up and bring food. And I'm not talking about like, oh, here's some really lovely desserts that you could share with guests. I mean, like, feed the family. Do something that now that person does not have to worry about doing. So bring food, bring a full meal, like bring the appetizers, bring the meal, bring something for dessert. If you need to, put it in disposable stuff so they don't have to worry about doing the dishes and returning them back to you, that kind of thing. Show up to their house and tell them, like, okay, I'm going to steal the baby, you go sleep for an hour. That kind of stuff where you're not necessarily asking them to tell you, I think is kind of helpful. Obviously, it doesn't work for everybody. This assumes a very close relationship with somebody. Decide if you want to have something from Talabat delivered, whatever, anything that you think might be helpful in that moment.
Thank you for those words of advice. Another question in the chat is, what should be the normal range of weight loss during the postpartum period?
Again, that in large part depends on how much weight they gained in the pregnancy in the first place, because how quickly you can lose that depends on how much did you gain in the first place. So you have some patients who don't gain a lot of weight, and then their rate of weight loss should actually be quite slow because you don't want them suddenly losing more weight than they had gained. Other patients, especially if they had complications like diabetes or something like that during the pregnancy, may have gained a lot of weight, and it's going to be a lot longer and slower for them to be able to lose that weight. So for a typical normal pregnancy with a appropriate amount of weight loss, usually half that weight gain should be lost in the 6 weeks postpartum, and then probably over the next 6 months for the remainder to a year. Depends on your exercise and activity level and so on.
Okay. And just a follow-up to that. So very often there may be, let's say, societal pressure in terms of a new mother has to lose weight. So that could bring about issues in terms of body image, in terms of self-esteem. What can we do in terms of what are the things that new mothers need to know, and what is it that family can do to help support them?
So I saw this on social media once, but I've remembered it because I've shared it with some patients since then, where a woman was talking about one of her children saw her stretch marks after having had a baby. And I'm sorry, I can't credit who actually said this first, but I just a long time ago saw it somewhere on social media. And so her young child saw her stretch marks after having had another child. And the child asked the mom about what the stretch marks were. And the mom said, "These are my tiger stripes because I'm going to protect you no matter what." So she turned the whole narrative around and owned it. And I think that whether you're postpartum or whether you're just a woman in general in our society, I think you have to try to take that narrative and turn it on its head because it's pervasive and it's everywhere. It's not just going to be in the postpartum. So try to have the self-confidence and the self-assuredness to be empowered enough to turn it on its head. But it is hard. I know it's hard. So I'm good luck.
Okay. There's another question in the chat about, in terms of recovery period postpartum, from the perspective of someone who is a working mother,
Yeah.
does that change at all?
Well, hopefully you're in a job where you're at least getting 6 weeks postpartum. I should hope so. And if you are able to get more than that, then that's great because it gives you important time to bond with the baby, to take care of yourself, to feel more like yourself before you, because at 6 weeks, you just barely start to feel like yourself and you're like back to the grind of work and so on. So the more that you can take, if you can take several months off, then that's fantastic. But assuming that, let's say you are, somewhere like in the US where they really just give 6 weeks off, then yeah, your body is not going to be, suddenly at 6 weeks back to what it was pre-pregnancy. You still have to be careful. You still have to like build up your endurance and tolerance to things. You're going to get tired easily. You still have a newborn at home who's not letting you sleep, even though you have the same work hours. So all of those things are going to make the transition back to work potentially a little bit more complex. And so having family help, assigning breastfeeding, baby feeding to the partner during the night so you can get more hours of uninterrupted sleep. Those kind of strategies can help as well, but it can be tricky. And just really, sort of follow your body, take time off if it's allowed, to have a little bit more time to give yourself time to heal.
Okay. Another question I have is, so incontinence, constipation, hemorrhoids, these are not uncommon after delivery. So what are your tips for new mothers when it comes to those?
So stay hydrated. That's super important, absolutely critical. Drink plenty of water, especially if you're breastfeeding, because so much of the liquid that you take in is going straight out back your body to the baby. So it's not going to help fight constipation unless you're really drinking a good amount of water. High fiber diet, or like a good, well-balanced fiber diet, is important to help regulate. And then some women end up having to take stool softeners. I don't love laxatives because laxatives are a little bit more aggressive and can cause cramping. They're a type of medicine that actually causes the intestines to squeeze. But stool softeners, like there's many different types available in Qatar, they help pull water into the stool to keep it soft, and they do that without causing cramping and pain, and they're much safer, and they're safer to take on a longer period of time. So you can absolutely do that. And if you do have hemorrhoids, you must control the constipation, because if you continue to have constipation, it's going to make the hemorrhoids so much worse. You can use like the donut cushions and things like that as well. There's some different hemorrhoid creams that are available, but really treating the constipation is the critical piece. And the tricky part is, if you're in the hospital and you get the stronger pain medicine, which are opioid pain medications, those will cause really bad constipation. So we usually in the hospital will give somebody medicine for constipation when they're taking those medications, but not always like continue it when they're discharged home, but they may need to continue it for several more days when they're discharged home.
Okay. So there is another question in the chat where the person is inquiring as to whether it's a good idea to take supplements in the postpartum period. Do you recommend that in general practice, or
Yeah, I mean, it's what I usually tell my patients is to continue their prenatal vitamin, the same vitamin that they were taking during the pregnancy, for the next 6 months. If you run out of your supply at 4 months, that's fine. But like somewhere between 4 to 6 months, go ahead and take your regular prenatal vitamin that you were taking during the pregnancy and eat a healthy diet. In theory, if you're getting a really actually well-balanced, healthy diet, you don't need supplements. But in the reality, very few women are able to successfully take in a healthy, well-balanced diet to the point where they don't need supplementation. And it's not usually going to hurt. If you're just taking a prenatal vitamin, it's not for a few months, it's not going to hurt. And that's that I'm just talking a straight prenatal. There's some women who will have had significant anemia, whether it's because of blood loss or whatever during the pregnancy or delivery. And those women may need to have iron supplementation to help recover from anemia, which can also sometimes lead to constipation. So that definitely has to be taken with a stool softener. But I don't lump iron supplementation with just sort of general vitamin supplementation. I think of like iron as more like you actually need this medication.
Okay, thank you for that. I don't see any more questions in the chat at the moment. So I would like to take the opportunity to thank you, Dr. Moune, for that wonderful talk. And I also wanted to thank all of our attendees for taking the time out to join us today. And we hope you'll join us for the next session. So thank you very much and have a lovely day.
Thank you so much. I really appreciate the opportunity. Thank you.